We're going to talk about stress and how it affects chronic pain. Chronic pain is any pain that lasts greater than 3 months. A lot of processing happens here in the spinal cord region and then also here in the brain region. Processing is determined by chemicals in those regions. So it's a purely chemical reaction, but it is something that we have control over. And it's heavily influenced by some of the stress hormones, cortisol, norepinephrine, and epinephrine. And what they do, there's a feedback loop. Basically, the brain stimulates this, and then this neuron stimulates the brain. And it's a positive feedback loop that's enhanced by these stress chemicals. And so the goal is we really want the processing to interrupt this connection from the brain to the nerve. There is an objective measure to kind of tell how stressed you are each day, and that's this HRV. The heart rate variability is low in times of stress, and so this is kind of like around 30 milliseconds or less, and then it's high when you're relaxed, and this could be like 70 plus milliseconds. A couple of things that you can do is mindfulness stress reduction. Basically, mindfulness-based stress reduction is kind of like a type of meditation. They did it a lot here, 45 minutes, 6 days a week. You don't need to do it that much, but you can see people were able to decrease their opioid medications and reduce pain. So they cut their medications down and they reduced their pain. With cognitive behavioral therapy, they only did 1 hour a week. The pain decrease was less, but still it improved. In this one, they did yoga, 2 to 3 sessions for 45 minutes a week. And Tai Chi did even better than aerobic exercise. Here's aerobic exercise, moderate intensity. Generally, it's 150 minutes a week is what's recommended for other things, for your like cardiovascular health, your other health areas. And that reduced that stress hormone that we talked about, and also chronic pain. Next, diaphragmatic breathing and guided imagery. So this is just kind of like where you're taking deep breaths. When you're in pain, just sit still, breathe in through your nose and out through your mouth for 5 minutes, 3 times a day, and you'll lower your average pain by a point. Another thing that lowers the stress hormones is having better sleep. The recommendation is 7 to 9 hours in a dark, cold room. Lastly, social support. And you can see just having quality people in your life and quality relationships lowers your pain score by almost half a point. So that's like from a 6 to a 5.5. And the tip to do this is just to schedule weekly friend and family time. Can be your son or daughter, or you can just call them for 5 minutes. Around noontime, you can go to the park and interact with somebody there, or the store, even if you don't buy something. And again, it's just 5 minutes. It will hold you over for hours. So if you do this one at 8 a.m., it will keep you tied over. It's that real physical in-person interaction. Evening, family dinner time. Just do every day if you're able to do like a 5-minute journal. And there are a couple things you can do, just like name 3 things you're grateful for. That increases positive emotion, does reduce stress,